Daniel Kagan is next. Daniel, take it away.
Well, I think Hala did an excellent job about kind of trying to inspire everyone about thinking big, and so did Chris. And, today we're talking about healthcare. That's certainly a big problem. So the goal today is not to create a healthcare debate, but rather to provide a little bit of an overview for those of you that don't know the current system, provide a potential solution, and from there kind of discuss how we can take it as a Siebel community forward. And so when I think about healthcare, I feel like going to the doctor is a lot like going on an airplane. Everyone in the room has a story, whether it's going to the doctor's office and waiting 3 hours just to get a prescription, or whether it's spending or whether it's getting that bill 4 months later and wondering, where did this come from? Well, these are just kind of the small issues. Let's kind of look at the current completely inefficient system that we have today. Well, over the past 30 years, healthcare costs have increased tenfold to $2.7 trillion, which actually accounts for 18% of our GDP, and that's rising. Now, when you break that down, that's $8,000 per person, and that's twice what Americans pay per food every year. And when you look at healthcare costs, people have said that 1/3 of all healthcare costs have no value in terms of helping out the health of the individual. And of the remaining 2/3, 1/3 of those costs are associated with preventable diseases. So let's kind of zoom in and look at what's adding this excess weight gain to our current budget. Well, the first thing is we have a billing and records and billing and payment system with the insurance companies that has no transparency, and they're constantly talking with doctors and bickering over rates. When you look at MDs, we have the most specialized MDs in the country, and with that, they demand the most amount of pay, and they use a pay-per-service model, which only increases the amount that we're paying. Next, along those lines, costs for medical supplies and drugs are 60% more than other countries. And when you look at medical liability and insurance, that's just adding to the overall cost. And the other big thing is in America, we rank in the bottom 10th percentile for preventive healthcare doctors' visits. And so our capitalistic society has been great for innovation, but where it really falls short is that it's created so much competition that it's so fragmented and it's created this inefficient system. So now the goal for Med for Us, and there's a lot of parodies on the name, but the goal for Med for Us is actually to create an advocacy group that can form one solution from the ground up, taking in mind all of the different aspects of doctors, patients, insurance companies, and corporations, and having a nonprofit solution. And the goal is to create that solution and then be able to provide affordable healthcare system that has a completely transparent medical records and payment plan. So, what are the areas of inefficiency that we'd like to talk about today? Well, they start with administration costs, the cost per visit, the medical liability, and preventive medicine. So what are some potential solutions in these areas? Well, the first thing is one of the goals would be to pre-negotiate rates with doctors even before starting an insurance company. When you combine that with a centralized billing, payment, and record system, it's there where you can start offering transparent pricing. And if you have a transparent pricing model, now what you get to do is shift some of the decision-making from the doctors to the patients, where they can start deciding whether they want those unnecessary tests, which a lot of people are considering as one of the largest drivers of this increase in costs. Second, in terms of looking at the cost per visit, one of our focuses is actually on primary care. As we talked about specialization, if you could actually create facilities that specialize in things like common transmittable diseases and chronic illness, as well as preventative care solutions and having people take physicals. Second, if you have an insurance company that is directly in line with doctors, it's there where you can start using economies of scale and negotiating with suppliers for medical supplies and medicine. And so you can have everyone in the network starting to reduce the price that they're paying for these drugs. When you look at medical liability, one of the problems is just the added legal cost. If you have everyone in your network signing a mediator agreement and then combining that with actually having everyone be incentivized to watch videos on their impact on the system, it's there where you start getting this cultural change, in which we were talking about yesterday. And finally, preventive medicine. One of the biggest things that have been shown to be successful on a small scale is incentivized healthcare. And then when you combine that with added benefits of having people incentivized for healthy eating, incentivizing for going to the gym and discounts there, what's been shown is even at the age of 25, for every pound that you are overweight, it costs you and the system $25. At 50, that rises to $75 a pound. So, in order to enter such a daunting market, it's very important that we look at how the doctors, patients, and corporations feed into this system. So what I started in the beginning was actually talking about this concept of pre-negotiating rates with doctors. So what's their objective? Well, their objective is actually to be compensated for their expertise, cover their expenses, and of course help the patient. So with our program, the goal is to kind of give them what they want. So give them great rates up front. And then what you do is you start reducing their liability. And finally, the big thing is reducing their responsibility by having one streamlined platform that's easy for them to use. Second, you're able to incentivize primary care as well as preventive care, allowing them to spend more time with patients. Second, the next thing is you need to start implementing you need to start implementing the corporations. And what they're looking at is pretty much a medical record, pretty much a system in which the patients are happy, and so there's a lot of benefits, and it reduces their cost. And so by having pre-negotiated rates reducing our cost as well as the doctor's cost, you can start offering low affordable rates with all the benefits I've mentioned as well. And finally, the patient. They're looking for things very similar to the corporation, and by having one centralized system, what that will really allow you to do is streamline the entire process. So from the time that they sign up an appointment online to the billing process where they can pay online, they have now a streamlined process with complete transparency and all the benefits that we were just discussing. So I just talked about a lot of ambitious ideas, and I realized, being myself and a couple of people working on this initiative, that's not enough to kind of make this change. And for that reason, what I'm actually looking for is, my goal is to start getting the experts in the room, the experts in our networks, to come up with one specific plan and strategy to get universal support. From there, the goal is actually to use a website and digital marketing campaign in which you start reaching out to that 90%, which Ralph Nader was saying is only focused online. And what you do is you start getting their support, their feedback, validating assumptions, and implementing some great ideas from people, from corporations, from the public, from other doctors. You start implementing that into the plan, followed by having a convention. And the convention will be taking these thought leaders, taking these patients, taking the corporation CEOs, getting them to fill in the details on this plan, which is going to be completely transparent and made to the public, and then getting them to sign on the dotted line in terms of having that summit where they will say, I approve this idea, let's move it forward, and then you have the resources to do that. So Tom was talking about yesterday about this community actually amplifying our voice, and I think that is what we need to do. We've had all these great conferences in which we've thought about these great solutions, and in this room we have people that are MDs, we have people that are healthcare VCs, we have people that work at all these consulting companies, and then we also have the computing power to make a system like this come up overnight. So with that, I would like to say that this is also the perfect time to enter. One thing with Obamacare is they're starting to support nonprofits. And finally, the other thing that it is now's the perfect opportunity, because electronic medical records are starting to fragment all over the system. It's at this point where we need to start utilizing our resources to make sure that we have a more centralized and cost-effective solution moving forward. So I wanted to take this time to thank the community and Tom and the Siebel community for allowing me to speak. I'd also like to thank my business partner, Biki Shalone, who's in the back and has helped me both with this awesome presentation, but as well as kind of getting these ideas. And I'd like to focus on questions that are really aimed at the solution and not just discussing all the different problems out there. So thank you.
Hi, Daniel. Thanks for the great talk. I'm Marcio Valmulen, class of 2010 from MIT Bioengineering. You mentioned a lot of sort of specific areas of inefficiencies of our system, like too many preventable conditions and too many tests and those sort of things. Can you talk about why you think the current system and the smart, rational actors that we have, insurers, doctors, patients, what is preventing them from fixing those things with the current system as is? And why do you think we need kind of a complete overhaul versus smaller, simple step solutions given the complicated system that we do have?
Yeah, I mean, that's a great question. Well, let's just start with maybe to address your question, just looking at the insurance companies. A lot of their money that is invested is actually going towards lobbying, and they want to keep the current system. And because by having what a lot of people have argued, by having a for-profit system and constantly arguing over these rates, and that's their whole structure. They have a cost structure based upon that. They have employees based upon negotiating rates. And so that mentality, I think, is not going to change overnight. And I don't think that we can wait until that changes. As well along those lines is insurance companies don't want to publicize rates. They will not sign up for these electronic medical record systems. That's why Kaiser is actually one of the few people that is starting to develop this, because it's an in-house system. And so I think at the same time you have doctors which are to answer your question, they're incentivized by this pay-per-service model, which allows them to make more money by the more services they have, rather than a system that kind of focuses on preventative care, giving them more money and investment up front, and kind of straying away from those unnecessary tests. And I hope that answered some of your questions. It's a more in-depth question besides that.
Yeah, hi, Livingston Taylor. One of the things that when in terms of preventive medicine, clearly there's a channel coming in, i.e. Food, lifestyle, McDonald's, Archer's, Daniel, Midland, who are pumping into us all kinds of food, etc. And it seems to me that they're left out. Not entirely. Michael Bloomberg takes them to task, etc. But it surprises me that there's so little attention paid to, and there's lip service given to it. But I wonder what are the chances or the opportunities to engage in a real way the massive corporate structures that are feeding us, that are adding calories and nutrition to us, and yet have seemingly very little responsibility for the result on the other end, i.e. they're not paying for diabetes after the obesity occurs.
Yeah, and I think that's a great concern. And I'm a big Bloomberg fan, and I think taxation might be a solution. But this kind of brings us back to the idea of corporations being responsible. A lot of the debate that we talked about yesterday. I think my goal is to focus more on mobilizing the citizens of the United States, which most of us, there's enough educated people out there that want change. And if you mobilize them, what we would allow us to do is kind of change that culture from the inside. And we were talking about smoking the other day in terms of how it became taboo. Well, it's been shown at Safeway, for instance, where they've implemented some of these changes, and especially in terms of healthy living and incentivizing health, is that people start working together to actually, they have running teams, and on average, it's also, in just 2 years, their costs have remained stagnant, where the entire cost of the entire system have gone up 40%. And so it's shown that some of this preventative healthcare can even work on the immediate time. So to answer your question, I think more on focusing on the citizens coming together and creating a solution, and less on focusing on the things that it's harder to control, and that's lobbying corporations and the government to make those changes.
Hi, Dan. I'm Angelina from UC Bioengineering, class of 2013. I really was glad that you brought up preventative medicine as a solution to perhaps a lot of our healthcare issues. And I was wondering where you propose to start with that. Is that with adults now? Is that in the schools? Is it in the family structure? Because, people are difficult to change. And I was wondering if you had any thoughts on that issue, whether it be obesity or smoking or all the other sorts of things that we can potentially prevent.
Yeah, and I think if you provide the right structure up front in terms of an insurance company that's incentivized healthy living. And so for people that don't know about that, I would start with kind of having the policies. And so what that means is that people get discounts if they go get a physical. People get discounts if they go you could even give them a gym membership. I mean, $25 a month is hardly, it's a drop in the bucket compared to the cost we're talking about. And then as well as having them incentivized to lose weight, having them incentivized to hit those BMI metrics or cholesterol rates or blood glucose rates, that would allow people financial incentives. And I think that financial incentives might be a driving force. But I think that there's enough creativity in this room to kind of add into that and kind of focus in on maybe there's one or two ways that we can even start that start that campaign before we even start it, something like this type of insurance company. Thank you, Angelina. Sorry.
Hi, my name's John. I'm a 2013 Siebel Scholar from U of I. Thanks for this presentation, Dan. I thought this was very timely. I wanted to ask, you mentioned one thing about comparing some of the problems in our healthcare system to other countries. Mm-hmm. Have you put any thought into examples of other countries where their healthcare system is working well, or lessons we can learn from other countries, or have you already taken some of those ideas? Yeah,
in all honesty, I have looked at some of the other healthcare systems, and one of the issues is in many cases it's either socialized and government run, and as we've seen with the new Obama healthcare, that's not even in the plan. In fact, doesn't look like that's likely. But kind of taking some of those goals and making it a social resolution, getting the experts to kind of making that change so that you have a nonprofit system that would kind of mimic some of those changes. I have not looked specifically on an example. I've kind of been focusing on how to change it given our United States situation, but that would be a great area to kind of look into even more ways to make this a reality even quicker. Thank you.
Dan, thanks for the presentation. Jeff Goldberg, MIT Sloan, class of 2001, and part of the healthcare establishment. So I've taken objection to some of your facts and figures, but we can talk about that offline. I have one specific question I wanted to hit, which is you've got a system that's going to attempt to revamp what is a $2.7 trillion industry in the U.S. alone. You've got governments, you've got companies, you have essentially the entire U.S. economy tied up in what you're trying to do. And I applaud you for your vision. Thinking big is great. So specifically, how do you think about issues of scale? How do you think about bringing in, getting 100 people to do this is great. Getting 1,000 people to do this is great. But you're talking about transformative. You need to get 100 million people to do this.
Agreed.
And as you think about both the scale and scope of what you're trying to do, as well as the fact that a huge portion of what American healthcare is today is Medicare. How do you bring both the populace that is on private pay, but also the, whatever it is, 20, 30, 40, 50% of the populace and the spending that is currently run through these government systems that will never adopt your approach? So how do you reconcile those things?
Just to clarify, why would they never adopt it?
Have you worked with Medicare?
A little bit, yes.
So they're set up around a system that is so heavily bureaucratic, that is so heavily built. It's like trying to reform the tax code. We talk about it all the time as being a great idea. But to reform Medicare, you're going to need such massive groundswell, such massive change that I fear you're biting off a lot more than any one person, organization, or frankly, country can handle.
Yeah.
So how do you reconcile that?
So, well, to start, scalability, what I was talking about, digital marketing, kind of getting that 100 million people. We've also seen, even with our own methamphetamine project, that you can start using scale and that we can, as a network, get a lot of people. The second thing is, in terms of Medicare, one of the goals is this might not be for everyone at first. Maybe you start small. Maybe you kind of get the data and kind of go towards one specific location with particular users that are employees of corporations rather than people that are currently on the Medicare system. You expand that out, and if the government starts seeing those savings that I'm hoping to project, especially in terms of preventative care, they're all about pre-negotiating rates with Medicare. That's kind of what they do, and they try and create that. Maybe at that point, the government will start seeing the value and get on board. But that is a concern, obviously, but it's not going to scare me away. This is not an investment that is that large in terms of trying to get users and people that are supportive of this idea. So my goal is, why don't we try getting that campaign started and getting that feedback and then see where that takes us. I'm not trying to say, let's start an insurance company with, the 10 grand I got in the bank and see where that goes. I guess, and that's what the whole goal is here, is we have the resources. So let's kind of put them to work, especially since I think this is a critical time in the healthcare industry, especially the next couple of years moving forward. Thank you for the question, though.
Thank you, Daniel. And let me congratulate all of the Siebel Scholars who you heard presenting here this morning.